Hey guys, this is Dr. Hub. Today we'll look at the MHC. We'll be comparing class 1 and versus the class 2. So to begin with, the MHC class 1. MHC class 1, this is expressed on all. It is expressed on all nucleated cells. So it is expressed on all nucleated cells. And there is an exception, so this is nothing but except the sperms. Next, as well as there are platelets. Next, what does this consist? So it consists of, there are a pleomorphic, there is a polymorphic, there is presence of the polymorphic alpha as well as the heavy chain. There is presence of a heavy chain. Next, there is a linked covalently, so it is linked covalent, and this is to the beta microglobulin, so to the beta microglobulin. Next, there is presence of the alpha chains, so the alpha chains, they are encoded by 3 genes. They are encoded. This is by 3 genes, coded by 3 genes, and this is going to be HLA-A, HLA-AA, then comes HLA-AB as well as the HLA-AC. Now they display antigen peptides. They display antigen peptides. So that are derived from the viral and the tumor proteins. Next, what we need to know is that the class 1 complex. The class 1 complexes, they are recognized, and this is by the CD8. So they are recognized by the CD8 T cells. Then comes the use of the endogenous peptides. So there is the endogenous peptides. So this is a type of antigen presented to the CD8. So this is presented to the CD8 plus T cells. Next, it presents antigen. This is via the cytosolic pathway, and there is an antigen binding site. So this antigen binding site is presented between, the alpha 1 alpha 2 groove. And next we have the A3, the alpha 3. This binds to the CD8 molecules. So alpha 3 binds to the CD8 molecules, and this is on the cytotoxic T cells. So this is on the cytotoxic T cells. So this was about the MHC class 1. Now let's go to class 2. So in terms of the MHC class 2, it is expressed on the antigen. It is expressed on antigen and this antigen presenting cells. So expressed on antigen presenting cells, and this is on the macrophages. So it is on the macrophages, and then there is a B lymphocytes. There is a B lymphocyte as well as presence of the dendritic cells. The heterodimer, it's a heterodimer, and it consists of the non-covalent associated. It has non-covalent, and this is associated with the alpha and beta chains, associated with the alpha and the beta chains. Next, both of which are polymorphic. So both are polymorphic. and they are encoded, so they can be encoded. They are encoded by the HLA-D, and there are some subregions. And they include the HLA-DP. There's HLA-DP. Next comes the HLA-DQ as well as the HLA-DR. So they are present antigens that are internalized into vesicles. The present antigens that are internalized into the vesicles, and they are derived into the extracellular microbes. Next comes the class 2. So the class 2 complexes, they are recognized by the CD4. So they are recognized by the CD4 plus T cells. Then comes the presence of there is exogenous antigens. The exogenous antigen is a type of the antigen presented to the and it is presented to the CD4 plus T cells. Then there is also, it presents antigen via the endocytic pathway. They present antigen, this is via the endocystic pathway. In the MHC class 1 it was a cytosolic pathway. Here it is the endocytic pathway. Then comes the presence of the antigen binding site. So the antigen binding site, is present between the alpha 1 as well as the beta 1 groove, and there is B2. So this B2 binds to the CD4, and this is on the helper T cells.